When it comes to dark spot treatments, there are so many skincare options out there that it can be hard to know where to start. What ingredients should you look for? And most important, which ones will get rid of dark spots for good? Let's talk about some options on what it really takes to treat hyperpigmentation and what it actually is. What's up, everybody? This is Elizabeth. I am the Minister of Beauty, and I share the Bible, that is business, inspiration, beauty, life, and enjoyment. I am a licensed esthetician. I am a skincare line creator, and to find out more about the Inez Elizabeth Beauty skincare line that I created several years ago, you can go to the links in the description box, and please do use the code to get 10% off of your first purchase. I'm also a brick and mortar beauty business owner and operator, and I just want to share some information because I get a lot of questions about hyperpigmentation. And if your ultimate desire is to achieve the no makeup look, like I prefer and honestly have the most time for, then these skincare ingredients and tips can help. But first, let's get into what causes dark spots in the first place, plus some dark spot treatments that I recommend. Dark spots or hyperpigmentation are due to the overproduction of melanin in the skin by melanocytes. This extra melanin can be triggered by a lot of different things. Hormones, both estrogen and progesterone, can increase the level of melanin. One reason why pregnant women see dark spots that often lighten following birth, or the pregnancy mask known as melasma, the sun can increase the level of melanin why we have more dark spots after the summer, and age can increase the size of the melanocytes. The reason why we see dark age spots in older people and even got the nickname age spots. Other factors like skin irritation as a result of acne, waxing, and harsh scrubs can also cause dark spots. Now that you know where dark spots come from, let's talk about how to get rid of them. Oh, and for those who don't know what melanocytes are, those are the cells in the skin that produces melanin, which is where the phrase, the term, the name melanin even derived from, melanocytes. Vitamin C can be used as a topical antioxidant that helps to block free radicals from causing oxidative damage to the skin, which can lead to wrinkles, fine lines, and a dull complexion, among other things. It also inhibits enzymatic processes that produce melanin in the skin. As such, it can help to reduce dark coloration of the skin. Another added benefit is that vitamin C lightens only the targeted problem pigmentation areas and not the rest of the skin. So it's not seen as a bleaching cream or a bleaching product. How to use it is to massage a few drops daily onto cleansed skin, preferably before applying sunscreen in the morning, and you can use it before you go to bed. The Reverse Reveal Serum in the Inez Elizabeth Beauty line is absolutely amazing, and I sell a lot of this product. One reason is simply because it works. This product did wonders for me. You can see from the pictures in this video. I started my skincare line in 2017, and it was an issue for me. And when using my products, it definitely helped to reverse this hyperpigmentation issue that I had been suffering. And after using and having the bad experience with using another product from another skincare line, it caused more irritation to that area. So using this product worked wonders for me, and I am absolutely in love with it. I use it every day, and I highly recommend it, not because it's my skincare line, but because it works. Kojic acid, derived from mushrooms or fermented rice, is commonly used in skin lighteners. It works by suppressing a key factor in the activity of the pigment cells. The risk commonly associated with topical kojic acid is allergic dermatitis, and that is why it is primarily found in relatively low concentrations. Those with sensitive skin should opt for small doses during nighttime only, since inflammation and irritation can be side effects of using this ingredient and products with this ingredient. Also, don't expect to see speedy results with kojic acid. It can take several months to see improvement of hyperpigmentation with the use of topical kojic acid. But to be honest with you, anything regarding hyperpigmentation, it is going to take time, because the one thing I educate clients on so much is that hyperpigmentation literally can happen overnight, but it will not reverse overnight. So to use kojic acid, it's recommended to use at nighttime and only on the dark spots or areas of concern. The Brighten Up Serum in the Inez Elizabeth Beauty line is perfect for hyperpigmentation. And what's best is it has low concentrations of kojic acid, so you can not only spot treat with this product, but you can use it all over your face to give your face an evening and brightened appearance. And this is a product that I use for spot treating when necessary, but I definitely use for all over brightening up, as well as moisturizing as well, because of the hyaluronic acid in high concentrations in conjunction with the low concentrations of kojic acid in this product. Azelaic acid, this lesser known ingredient, is a dermatologist recommended treatment for dark spots on the face. So what exactly is it? Azelaic acid is a naturally occurring extract from oat, wheat, or rye that interferes with the production of abnormal pigmentation. One of the bonuses is it has antibacterial properties that can help banish acne and the scars pimples leave behind. In addition to dark masks, azelaic acid can help address redness as well as blemishes and breakouts. So to use it, you would apply it all over your face once or twice a day, and you can use it alone or with your favorite facial moisturizer. When using it during the day, just be sure to follow it with sunscreen. Speaking of sunscreen, at the end of the day, prevention with sunscreen is key. The good news is preventing dark spots is often as simple as wearing sunscreen, which you're already using every day, right? Daily sunscreen is the absolute best way to prevent hyperpigmentation. Even low levels of UV light exposure add up over a lifetime and can cause dark spots. Dark spots will get darker with sun exposure. Sunscreens, and particularly physical sunblocks that have either zinc oxide or titanium dioxide, can block out most of the rays that will darken the dark spots. For true protection, you need to use a broad spectrum sunscreen, at least SPF 30, to guard against sun damage caused by UVA and UVB rays. Reapplication of your sunscreen every 2 hours, even if it is labeled all day, 24-hour, waterproof, etc., is necessary, especially when you are treating hyperpigmentation. I'd also advise sun avoidance in general, especially for sensitive areas, between 10 a.m. and 4 p.m. Even visible light can increase skin pigmentation. If you're out when the sun is highest, seek cool, shaded areas or wear protective gear or hats, which helps protect the skin from sunspots. So you want to use sunscreen daily and reapply every 2 hours if you're in direct sunlight. So we've discussed the ingredients and products that help to treat hyperpigmentation. So now let's discuss some treatments and services that you may want to consider. Exfoliating treatments like chemical peels remove the upper layers of dead skin, helping to reduce the dull appearance of the skin so that it reflects light better and appears to glow. Over time, these treatments can stimulate collagen production, enhance cellular turnover, and reduce the appearance of dark spots. But beware, a chemical peel that is too powerful, which can burn the skin. Common active ingredients in pro-grade peels include glycolic, mandelic, salicylic, and lactic acids, along with trichloroacetic acid. While at-home peels are available, they are more likely to slough off dead skin rather than get deep enough to lighten dark spots. So, of course, keep in mind that chemical peels can be harsh, particularly on sensitive skin. So be sure to talk with your professional esthetician or dermatologist about how you may react before booking one of these sessions. And typically 3 to 6 treatments, maybe more depending on the severity, spaced out by 3 to 4 weeks is needed to see results. Microdermabrasion is another well-known exfoliating treatment for hyperpigmentation that uses tiny particles to slough away dead skin. It is a non-chemical procedure that's non-ablative, which means it does not destroy skin tissue and therefore does not require significant recovery time. Microdermabrasion is best for milder hyperpigmentation conditions since the results are modest in terms of improving the appearance of skin discoloration. I would recommend 3 to 6 treatments, possibly more, spaced out by 2 to 4 weeks. Consider this a treatment not for the faint of heart. Performed using a medical-grade stainless steel roller covered with hundreds of tiny spikes. The tool creates a series of micro-injuries in an effort to rebuild the skin collagen production, along with elasticity. While many at-home versions exist, I recommend having your physician control the level of penetration and think 0.5 millimeter to 2.5 millimeters. For best results, microneedling is often combined with topical treatments. Once the skin barrier is opened, it is also possible to infuse ingredients known to lighten the skin, like vitamin C. Dermatologists might also use a wound healing serum or a compound of hyaluronic acid and vitamin C to help with hyperpigmentation, especially in darker skin tones. But note, there is a potential risk for scarring from microneedling services if they are performed too aggressively. And darker skin patients may also find that they become more pigmented. So it's something to be aware of. But when done correctly, you will see a brighter complexion by the next week after treatment. This service is definitely on the higher priced end, and expect to do 3 at least. Treatments is sometimes more, but it would be spaced out every 6 weeks with a dermatologist or a licensed esthetician performing these services, because this is more aggressive. This is something that would be spaced out with more time in between. So there you have it. In treating hyperpigmentation, one, you have to really know what it is, and you have to know that it's going to take effort in order to see a turnover and see results, because everyone wants to have an even skin tone, but hyperpigmentation is just one of those things that unfortunately a lot of people have dealt with, whether on the mild side, moderate side, or the severe side. So you just have to be cognizant of what it entails in terms of treatment, and be dedicated, diligent, and willing to invest in the products that you need, the time that you will need, and the effort, as well as recommended professional skincare services in order to see results in the hyperpigmentation turning over. And it's worth it. I've had to deal with it. I've shown you what I dealt with and how I made a change in my skin, and it is something that I have to be aware of. So I am doing everything that I can in terms of prevention, but if it happens, then I am treating. So I hope you all got something from this video. Let me know your thoughts in the comment section below, and thank you so much for liking and subscribing to the channel as well. This is Elizabeth, and I share the Bible as the minister of beauty, and that is business, inspiration, beauty, life, and enjoyment. So until the next time, I hope you all have an amazingly blessed and beautiful day.